I'm Father Mitch Pacwa, and welcome to EWTN Live, where we bring you guests from all over the world. Tonight, we didn't have to go too far, just over to Atlanta, Georgia. And we will be talking about a very important topic, the dangers that are inherent in the current medical and public policy approaches toward children with gender identity issues and gender dysphoria. That is, they feel uncomfortable in the gender they were born to. With the explosion of the number of teenagers identifying as transgender, it's a very important and timely topic. Now, we want to let you know at the outset that there may be some parts of our conversation that may not be suitable for younger viewers. So just be alert to that, but it's going to be important for us to address. Our guest tonight is a pediatric endocrinologist. He knows in depth what the, quote, transitioning process entails, from puberty blockers to cross-sex hormones and surgeries. We'll discuss what's behind the push for these treatments and how best to help those suffering from gender identity issues and gender dysphoria, as well as the church's teaching on what is the morality here. So please welcome the immediate past president of the American College of Pediatricians, Dr. Quentin Van Meter. Dr. Van Meter, welcome.
Thank you for having me.
It's a delight. We had met over in the Republic of Texas a few months ago, in which you gave a talk to a very distinguished group of politicians and ministers of the gospel. And I was very impressed with what you had said in our conversation, so I'm glad that you could join us here for presenting this to our audience. First of all, what's some of your background? You're a medical doctor, and you focus on endocrinology.
So I started out as a pediatrician, out of medical school, chose that particular specialty. And I was always in love with endocrinology because it just made sense to me in terms of how I learn. Mm-hmm. I'm not a good memorizer, and so there's balances of hormones and actions of hormones, too much, too little, and it's very easy to get a simple unifying concept and apply it to a number of hormone systems in the body.
Okay.
So it worked, and I've always loved children, taking care of children. Yeah. And I just look at endocrinology as an extension of my general pediatric practice. In my heart, I'm a pediatrician. And
you and your wife have a few children of your own?
We do. We have 4 adult children and 5 grandsons, and a sixth grandchild who's the first girl, and she'll be born in September. So she is going to be smothered with a lot of love.
Yeah, that's good. That's great. Now, this issue of gender dysphoria, people dealing with gender identity problems, when did you see that start to come up? I don't remember anything about that when I was growing up. Where does this come from?
Well, you and I are sort of about the same vintage, and I grew up through my childhood not having any clue that this was on the face of the earth.
Right.
It lurked in adults primarily, a very tiny percentage, maybe 6 out of 100,000 adult men and 3 out of 100,000 adult women. Clearly the ratio, many more men who were suffering from this. Mm-hmm. So you didn't really know children that were having these issues because they didn't present. They just weren't there. In my fellowship at Johns Hopkins, Professor John Money was the person who coined the term gender identity. And he took a word from linguistic term, gender, which had to do with nouns, male, feminine, or masculine, And he applied it to the internal sex self. That's what he invented this concept that there was a gender identity. And it could be made different, or it was different than the biologic sex. Seemed a little strange, but he was the professor. I was a fellow in training. And so we did a lot of listening. We did take care of his adult patients. He had about a dozen adult patients that he worked with, but primarily he worked with infants and children who had disorders of differentiation of their genital structures that made it difficult to recognize right at birth whether or not they were born a boy or a girl. And that fascinated him, and he wanted to see about the psychological aspects of those children. What did they go through? How did they view themselves? So he had a large stable of patients that came to Johns Hopkins from referral centers around the country. And he worked with the families, and he thought he could sort of play God. He decided that if this baby didn't really look very much like a male, even though he biologically was a male, perhaps it'd be best to raise that child as a female. And he experimented open-ended with his theories. He used to say, I have a theory. Let's try it on for size and see what happens.
Whoa. I mean, isn't there an ethical issue about doing experiments on children who are themselves not legally or psychologically or intellectually capable of agreeing to be experimented with?
It's a serious ethical issue. This was long after the Geneva Convention was, had medical rights of the patients and the safety of those who could not consent to not have these kinds of things done to them. But Money just breezed through that as if it wasn't important. He figured he knew the answer, and he was going to see if he could get there. And so very soon after that, all of his experiments on these infants and toddlers fell apart. One with a tragic case of a suicide of two twin boys, one of whom was changed into a girl and did not live successfully as a girl. And so the Johns Hopkins saw through all of this, the senior faculty, and closed down both the adult program and the children's program as well. So that lay beneath the surface all the way through the 70s and 80s. We didn't know anything about gender incongruence in children. After I graduated, I saw one patient in my private practice who was a boy from a family that came from California, and he was 13, and his psychiatrist had told the family, he is actually a girl, so you need to give him a new name. You're moving from California to Georgia, great opportunity, change him into the girl that he believes he is. I didn't find any advice from any of my mentors. I called around and said, what am I to do? Is there a protocol? I mean, this is just so rare. I was up I didn't know what to do. So we designed sort of a protocol to try to put this boy on some estrogen. And the family quickly moved out of the area. Dad was in the military and he was transferred. So I never really got to see anything beyond starting this child on estrogen. And it was not a comfort zone. I did a very complex consent form that sort of protected our medical practice legally from any repercussions. But it was just the strangest thing. And I had nobody to tell me what to do. So that was 1993. Now,
So we're talking the first of this appearing would be in the late 70s?
late 70s.
And then you see your first patient yourself in 93.
Correct.
And why is it so much in the news? How has this developed as an issue?
In Europe, some adult psychologists were working with the adult patients, and the adult patients complained that their adult lives were really difficult because they couldn't look like the sex they wanted to be because they had gone through natural puberty and their bodies had changed. So the people that thought they were wanting to be women looked like men physically. They had broad shoulders, beard, and they said, my voice box is too big, I can't pass off as a woman. So how about if we block puberty before that ever happens in the children that are sort of presenting in the Netherlands? So a protocol was developed, and it's referred to as the Dutch protocol. And they started a group of children in about the year 2000 and developed a treatment protocol that worked very heavily with the undercurrent emotional issues, because they did recognize that this is a state of mind, that this is something that comes from very deep trauma. And they screened out all the children and took care of their mental health issues, they thought, and the ones that were left over who desired to impersonate the opposite sex were put into another experimental situation. They signed consent forms by this time, and they were their puberty was blocked. They were given cross-sex hormones, and then they were handed on to surgeons when they could give consent, legal consent in the countries in which they lived.
Before these children were old enough to give legal consent, they were still given the puberty blockers?
Correct.
And cross-sexual hormones?
They were.
How is that legal or ethical?
Well, they carefully designed their consent forms so that the parents basically were those that consented. The children would, it's called assenting. Instead of consenting, they assent to the concept. They indicated that they had spent a lot of time with these kids, and both the parents had to be consenting with no coercion. They both had to be very, very supportive of this process in order for the protocol to move forward. So that group has been studied, and I'll come back to that a little bit later on. That was the basis on which the United States transgender clinics put together their protocols. And a very prestigious organization, the Endocrine Society, took the protocol that was developed by the Dutch folks and applied it to what they called medical guidelines for the treatment of transgendered individuals. And those were published first in 2009. And that was about a year or two after the very first transgender clinic opened up in Boston. Dr. Norman Spack, a pediatric endocrinologist, was salivating, they said, over excitement about bringing this protocol to the United States. So he started the first clinic, and then literally like mushrooms growing overnight, clinics spouted up to the point where there are over 70 transgender centers, most of them university-based. And they use this supposed protocol. But they don't really use the protocol. They jump in with both feet pretty much immediately. They're puberty blocking well before the Dutch did. They are giving cross-sex hormones well before the Dutch protocol said. And so suddenly this caught on like a social contagion, and things were going on in that time where kids were experiencing a lot of depression and anxiety. Just the general population, the children were experiencing these things. And they were.
And just so folks understand, this is something that goes up and down. For instance, in the period after COVID and during COVID, we saw a lot of more depression among children and anxiety because they weren't in school, they weren't around their peers, and they didn't have a structured day. And so there just was a lot more anxiety. So these can, different things in the culture can go up and down to have a larger number of people affected by things like depression.
The advent of the internet and access to the internet by children, pretty much unbridled, allowed these kids to see information that in our childhood we heard somebody talked about it far, far away, but no one knew really what it was. It's like pornography. It took the root on the internet and just spread like wildfire. Mm-hmm. So you have a population of children who are seeing that they're not happy. They don't like puberty. It makes their body change. Mm-hmm. And I often said puberty was a tough time for everybody I know. Okay, all four of my children, certainly for me, for the people that I've come to know and love. Everybody hated their body. You had pimples. Your teeth were too big, too small. You were going through puberty and things changed that you didn't like and didn't understand. But family was there. Family was there in my childhood, and up until probably the 70s, the schools did not touch those issues. The schools began coming along and teaching the kids what they needed to know about their self-image. Mm-hmm. And that included, being what is your authentic self. Well, that lights a fire and lays the kindling for a blaze to happen. That's exactly what happened. We went from adult men being twice as common in being trans adults as women. It flipped over to almost 3-to-1 females to males.
So men were dominant in this back in the 70s?
In the 70s.
And today, women are, it was like 2 to 1 for men more than women back then.
Correct.
Now it's 3 to 1. Women are experiencing this dysphoria.
And some statistics show it's almost 5 to 1 now with adolescent girls. And the shift was that in the most recent times, this presented from nowhere in adolescent girls. They had never in their childhood expressed anything to their parents. They lived happy, functional lives, supposedly, in the biologic sex that they were. But this becomes, a disease state to be a female. For whatever reason, they want to get out of their body. They want to avoid being a woman. They want to be a man. There's something that happens that makes them focus on that. And it's hard to get to that because the responses are so programmed and so uniform when you talk to these kids. They threaten suicide, and they say, I am going to kill myself unless you let me do this. Where did they get that idea? Well, they're told to say that. They're told that if they want to get through this process and get their hormones quickly, they want to have their breasts cut off, you be sure the first thing you say is, I am going to kill myself.
And this is something that I notice throughout our culture, that there are a lot of people who are using fear to manipulate others. They try to instill a fear in other people for a variety of reasons, because that makes them more manipulatable.
Surely.
And this is going on with these kids. I wasn't aware of that. And I know the CDC recently came out saying that depression among teenage girls is much higher than it had ever been before. So this, and using this fear to, because the last thing any parent wants is to lose a child.
Absolutely.
That there's just not a bigger heartbreak for a parent.
They would almost sell their soul to keep their child alive.
Yes.
It's that instinct.
And so when they manipulate that fear in a parent, they get what they want.
So at the outset, the people who wrote these treatment guidelines, they refer to them nationally as standards of care, but they are not a standard of care. They're an idea put together by a bunch of ideologues who are not using science. There's no scientific basis that said this is either safe or effective. I mean, there is absolutely none. They make studies out of thin air and publish them, and then they restate them, and they quote them, and they requote them. So the lie is told over and over and over again. And the standard person on the street says, I don't want to be a terrible person who is a hater or thought of as a bigot.
Right. Right.
You got me. And so that basically pounds that fear again into those who are observing, thinking, well, this must be true because I heard it on the news. My pediatrician told me that his organization, the American Academy of Pediatrics, supports this, and that we should just go along with it. And the pediatricians who are so busy and down in the weeds with their patients, they say, okay, from above comes this edict that this is how you will treat these patients. And before you know it, they're recommending that they go to these clinics. And
here's one of the problems. There's a little bit of information from the National Institutes of Health, who said that gender dysphoria in adolescents, current perspectives from March of 2018, they wrote, for 80% of children who meet the criteria for gender dysphoria in childhood, the gender dysphoria recedes with puberty.
Correct.
That if you let them just go through puberty, that recedes from the vast majority of them.
They are bathed in their natural hormones. Their bodies are designed for the hormones of their biologic sex.
Right.
So when those hormones come along, there are changes. It's kind of an earthquake, but things settle, and the vast majority, puberty becomes the cure for these kids with children with gender dysphoria. And so why are we taking away the cure and replacing it with something that we know is medically horrible in terms of what it does to the body? It sterilizes the body. It gives disease states that we fight tooth and nail in other patients to avoid happening. So so going through these
puberty blockers and cross-sex hormones, that causes physical problems?
Absolutely. It causes disease state. The overall lifespan of trans adults is 50% of that of the general population.
So the average life expectancy is about 80?
Yeah, and their life expectancy is about 40.
This is something that it's horrendous.
It's sinister.
And that's one of the things it seems. And I know also that the suicide rate among transgender people is 20 times higher than the average citizen.
Yeah.
This is, again, this is, plus just one other factor in this. I'm not a medical doctor, but from everything I've read about it, this is a process that sterilizes the person who goes through it. So they cannot sire or conceive a child after they have these surgeries. Is that correct?
Actually, some of the medical procedures themselves, the cross-sex hormones, if the ovary or the testicle is not mature because puberty is blocked, it never gets to the point where it begins to produce the expected gametes that will come together and procreate. And so it doesn't happen at that level. And then on top of that, you add very toxic levels of the opposite sex hormones, which basically polishes off that ovary or testicle. And then the pièce de résistance, of course, is removing it entirely.
Yes.
So, these kids, and they're running, they're just whipping their parents around like a dog by the tail. And they are saying things like, oh, I'm saving the world because I don't need to have children. I never wanted to have children. And so I'm saving the planet because I will, keep the population down. Or I will adopt. And everyone, oh, what a savant this child is. It's like, you have no concept, child, of what it is to be sexually active in a marriage and with fidelity and raise a family and raise your children and watch them start a family and then grandchildren following. You will never have that. You don't know what it's like. You can't imagine what it's like. Nobody really knows until you're in the middle of those wonderful life events. And they're just tossing them out saying, oh, I didn't want that anyway. And they have no idea. They can't consent to that because they have never, in these states of surgical stuff, they will not achieve orgasm. They will not have any sexual activity that works at all. Their body physiologic mechanisms are completely taken out. So there's no intercourse within it. There's no marriage. I mean, it's shot. It's gone.
Because of these physical changes and what happens in terms of dying, living out half of the normal life expectancy, a number of countries are now banning these procedures, are they not?
Yes.
In Europe, where it started,
right,
these procedures are now forbidden. They're no longer allowed.
They're very limited when they do allow them. In Sweden, that has to be done within a design of a research protocol, which essentially means it's likely not going to happen at all.
Yeah. Well, and I'm thinking about for minors in particular.
These are all we're talking about minors in these cases.
All right. So
the UK, Sweden, Denmark, France have
Finland.
all put the brakes on. And these were countries that were very, very pro this process. What happened is that they looked at the data. They finally found the data that was out there long enough to realize there was no improvement in mental health, and there were cases where it was actually worsened.
Yeah.
And if you're beating up somebody with fear that this child's going to lose their life unless you do this, you find out that's just one gigantic lie that we're having to swallow. And we should just tell the truth. This all needs to be unwrapped. We need to know what's happening in all the gender clinics across the country. They are all not transparent. They're very closed-lipped about what they do.
Except one doctor did let it slip. Boy, this is a moneymaker.
Yeah, that was one thing at Vanderbilt, and then at WashU St. Louis, one of the transgender centers. And WashU is a phenomenal medical school.
Yes.
They're in the business of this, okay? And one of their people in the clinic that was working, and I don't know the capacity, if it was social worker or counselor or whatever, blew the lid off of it and said, things are happening in this clinic that should not happen. And so she has been castigated and sort of sent packing. But the tent has got some tears in it now, and we can kind of peek in and see what's going on.
Mm-hmm.
And state legislatures are, state by state, protecting these children from ever starting this pathway. If you think that just the counseling alone solves the problem, because it is a basis, it's based on emotional trauma. And if you gloss over a volcano with a Band-Aid and say, see how pretty it looks, we fixed it, that volcano is going to erupt someday.
Yeah.
So you have, the right thing to do is to spend an inordinate amount of time digging deep into the family history, and it's painful. The families many times are the cause of the issues, and you're asking them to cooperate and reveal what they might have done adverse to their child growing up.
There's also a high rate of sexual abuse
Yes.
of the children who seek this out. Is that not?
There's an estimate of about 60%. Again, the data is so hard to find because it's not published. It's kept secret. And those issues aren't even addressed. And the counseling in these clinics is basically counseling the parents to accept what their child wants. That's the
Which
counseling.
means that there's an agenda by the clinic
Yes.
that I don't have much trust in. The United States Conference of Catholic Bishops has recently come up with a doctrinal note about the moral limits to technological manipulation of the human body. Came out in March 20th, 2023. That's just recent. And let me give a quote from there, if I may.
Sure.
It says, quote, "The body is not an object, a mere tool at the disposal of the soul, one that each person may dispose of according to his or her own will. But it is a constitutive part of the human subject, a gift to be received, respected, and cared for as something intrinsic to the person. Catholic healthcare services must not perform interventions, whether surgical or chemical, that aim to transform the sexual characteristics of a human body into those of the opposite sex, or take part in the development of such procedures." Now, what the bishops are saying here is something extremely important. While the rest of the culture is cheering this on, if you disagree with it, you are transphobic and all these other things. And meanwhile, people are dying. People are covering up the sexual abuse of the children seeking this. If that information is there and they don't publish it, it sounds to me like a cover-up.
It's hard to see it any other way when you know the background of these kids. I have been called transphobic because I will not give puberty blockers and cross-sex hormones. I cherish these kids. They come into my office and they are in such agony. And I don't think they're acting. Some of it might be a little bit embellished. But these kids are hurting so badly,
Yes.
and
That's a reality.
There it is. And so I look at my patients and I tell them that I am their advocate. My whole spirit and soul in practice of medicine is to do no harm, and to
That's
and to
in
heal.
the Hippocratic Oath.
And to heal. And so that balance a balance. And, you could certainly try to heal, but you can knock off your patients in the process with willy-nilly, unproven therapies. So. The idea is that I want them to be well, and I know the way to get them there. It is a painful way, but they will come out whole on the other end, and the kids that have been allowed that to have happen are well adjusted. They have much happier adult lives. A psychologist in Toronto, Canada, Dr. Kenneth Zucker, did this with young children all the way up through adolescence in the 1980s, from 1980 to 2013. and his clinic was shut down by the Canadian government.
Because he was doing the sex.
He would not go along with the statistics that said that these kids were, 40% of them are going to kill themselves unless you let them do this. He said, no, that's not it. And he published his data, and it got pounded. And he actually was the sort of the organizers of the transgender movement made sure that he lost his job. They were instrumental in shutting down his clinic. And so he actually sued the Canadian government and won. Which is a kind of a big deal in Canada.
Yeah, sure.
So, and he is a good soul. He knows what he believes and what he's seen. He used to be the go-to guy in gender issues in children, and now you can hardly find him anywhere. In terms of the guidelines that are written, he might be referenced in a maybe 900 reference document. He's mentioned 6 or 7 times, whereas before, he would be hundreds and hundreds and hundreds of references because he wrote the book on all of this. But he has been brushed aside and as a heretic.
And I throughout the development of the news about this issue, especially with sterilization being part of the process, and now, I did not know that life expectancy is cut in half. I didn't know that.
That was published by the folks who were doing this. I think they wanted to sort of say that it had to do with suicide, but they didn't actually bring it up in the article because it's not true.
Yeah, it's not about suicide, though there is 20 times more suicide in that population of transgender people.
Now, it sounds like that's quite a ratio if you think of that. But that study was comparing the tiny fraction of adults in Sweden at the time who were adults with transgenderism who had been treated with medicine and surgery both, compared to the whole population of Sweden. And that's been criticized because what they really should have done is to found the folks that went through counseling and resolved their issues and said, what's their suicide rate? That criticism, we can't really do a scientific study. It's not ethical. You can't start from here and say, half of you are going to go in the arm where it's potentially pretty sure you're going to be sterilized, and half of you will be in this arm over here where that won't happen. You would have nobody going over to this research arm because I don't want to be sterilized. I don't want to have no sexual function. So, I mean, those studies will, and ethically, no institutional review board, which is the governing body, external and unrelated financially and institutionally to the group that's doing the study, they would not approve a consent form.
And see, this issue of sterilization had gone on in this country with especially African Americans, a number of African Americans who had been in the prison system, and other folks who had mental disabilities, and they were sterilized without full consent from the 30s to the 60s, as I recall.
That was actually Margaret Sanger's whole approach to that, was to sterilize.
And that we are going back to that. When there were the number of lawsuits, and the immorality of that for people who cannot make full consent, even though they were physically adults, they oftentimes had mental disabilities that they couldn't consent, and it was done to them anyway. And now we see it here with children. This is something that down the line, the folks who are promoting this will be called to task for having participated. Now, we have to take a little break. We're going to come back in a couple of minutes with any of your questions and comments and further this conversation, so please stay with us. Welcome back. We are speaking with Dr. Quentin van Meter, who is the immediate past president of the American College of Pediatricians. And we're dealing with some of the issues of transgender and transsexual changes. You ready for some questions?
I sure am.
Let's start off with Joseph in the state of Texas. Joseph, what can we do for you tonight?
Well, thank you very much for taking my call.
Sure.
I have evidently a point of, in light of the recent COVID outbreak in this country, and everybody in the government, everybody says follow the science. Mm-hmm. This gender dysphoria, in fact, my granddaughter has become a grandson. I wonder, how do we now, as a government and the American Medical Association, now say, oh, it's fine to have children and everybody have this done and transition blockers, et cetera. Yet studies out of Sweden, England, and other European countries have said, no, this is no good. We've had it for a lot longer, and we're not going to do it for anybody under 18. And that's my question.
I guess, Joseph, given that, are people following the science? I think that's the way I'd put it.
Yeah.
Are they following the science after this has been rejected in Europe where it started, because they have more experience with it? Now they reject it. Where is that following the science gonna take us?
Following the science from the very beginning showed that there was no benefit to this, and that the natural process, if you have a disease and the cure rate is 80 to 90%, we jump up and down with joy. We talk to the families about the success and the good life thereafter. And that's what just counseling does. The suicide rate does not change throughout the whole process of this in the children that go through this. The rate is no different than any depressed or anxious children with autism. It's about 21% of attempted suicide in this group across, and this comes from a very liberal think tank at UCLA, the Williams Institute, which is a very LGBT advocate group. And they said, no, the suicide rate is not what they're advertising. So they publish pseudoscience, as if it were science. And then they just keep repeating that and do a study similar. They handpick data out of a big giant survey, which was voluntarily, the patients themselves volunteered to take part in the survey. It is not a representative sample of the broad population. The patients that are suffering most don't answer surveys. They just are living quietly and miserably and looking at what they've done. And the detransitioners are coming out of the woodwork now. They're speaking up. They were threatened. Their lives were threatened, which is,
I mean, people who are wanting to go
back from having lived the physically and medically and surgically as the opposite sex. They refer to it as sex change operations. You're not changing sex at all. You just add on or take off healthy parts of a body to make it look like a costume piece, and that's really all it is a costume.
Well, one of the points I've oftentimes made is no matter what surgery you get or what hormones you take, every cell in your body has the same DNA as at the point of your conception.
Correct.
That you are XY or double X, with a few exceptions here, there, triple X and so on. But you are the same chromosomal relationship of the X and Y chromosomes as you were before you were born.
Correct.
So you cannot change
your sex.
Your sex. You cannot change your chromosomes.
No.
And your body was meant to have the endocrinology of the gender you were born in. And conceived it. Again, this is at the moment of conception.
So to answer the gentleman's question about why would the government or why would the American Medical Association or the American Academy of Pediatrics or the Endocrine Society or the American Psychological Association, why would they would they say this is the right thing to do if it's not the right thing to do? And that's where the ideology comes in. This is all ideology driven. It is not science driven. And when you peel back the layers and you peel back the layers, you have to have an audience that will listen, first of all. And that's an interesting prospect because a number of times I have been disinvited as a speaker because I'm on my side of the issue. It's very hard to publish things because the publishers and the editors are very, very in the woke side of the world, and they want to publish what looks most current and compassionate. So it's very difficult. We can get letters to the editor. We are not in the business of doing unethical scientific experiments, so we're not going to do that. We're not going to have data that's based on a control population because it's not ethical to do that.
Right.
It's not ethical to sterilize people as part of an endpoint. It's off the map. So we're kind of in a little bit in a corner, but that's why and then the current administration is regulating these things and pushing them down. And there is large pushback from population. We are flooding their offices with notices that these are not appropriate, so that when it comes to court, there is clearly not a consensus. We have shown that there is no consensus on this whatsoever, and it will be a very strong basis on which to build legal cases to take to task those who did all this harm all the way along.
And just last week, I criticized President Biden. He's got his various political agendas, and that's something that voters have to deal with. But when he says that it's almost a sin to not allow transgender, I said, Mr. President, you cannot veto or give executive order to God on what sin is or is not. That's not your purview.
It's a great way to put it.
That God is the one who makes human bodies, male and female, and the church has clear teaching on what is valid and what isn't, what's legitimate, what isn't. And you can't create a sin by an executive order. That's not allowed. We have another caller, Joseph in Buffalo, New York. You there?
Yes, I'm here, Father. Can you hear me?
You're just fine. Go ahead. What's your question?
Perfect. Father, question for you. Is there a correlation between transgenderism and anything in regards to diabolic possession or obsession? What do our exorcists have to say? Question for the doctor. When a child threatens suicide, how can a parent distinguish between that being a real threat or not a real threat? And what can parents do if they don't support transgenderism, but they have family members who are willing to provide the child with treatment behind their back because they think that the child needs it for transgenderism?
You explain a dilemma that we face every time. The point is, if somebody is suicidal, you get them the mental health help. They need to be able to resolve the issues that drive them to that particular contemplating that kind of activity. And so if you send your child to a counselor that's part of a transgender clinic, that's a runway with no assessment of anything other than this is the right thing to do, this will cure you, you will be happy. So I specifically find independent counselors, and I talk to them personally and say, what would you do with a patient who is contemplating suicide, an adolescent who is threatening, and the parents believe that that's the case, and I personally could be convinced that the child is really thinking that seriously. They're going to go down in the basement and into the weeds if they're the right person, and they're going to unpack everything. And that resolves this in the vast majority of cases. Mm-hmm. And then the suicide ideation is gone because there's no reason for them to take their life. They have a reason to live as a result of untangling all the things that have been subterranean all these years. And so, yes, I take every suicide threat very seriously, and I say, I'm going to find you a counselor that does counseling in a very uniform, acceptable way that has nothing to do with politics or ideology. We're going to find you an independent person who will give you the help that you're needing. They won't just throw medicine at you. They're going to go solve the problem, and you need to find counselors like that.
I also think that I'll get to your other question, Joseph, in a second, but I think it's also important that we not buy into a theory that if society would just accept this as a legitimate choice to become transgender, if we would just accept it, then nobody would commit suicide. That if they're accepted in this, then they'll be happy because we're accepting and happy. I don't think that that's the case. That there is something else going on that's bothering them that has to be addressed.
If you look at the suicide data, just freestanding suicides, not related to any specific undercurrent diagnosis, it is clear that 95 to 98% of these kids are deeply troubled in general. Just they are emotional train wrecks, and that is common to all. It's not a specific diagnosis. So the suicide is not unique as to this problem. Suicide is what it is. It is tragic, but it happens in no one is a happy child who all of a sudden had a really bad day at school and takes their life. It's just that's not how it works. It is years and years and years of agony, boiling inside, and the only solution to stop the pain in their mind is to take their life.
Yeah. And and a variety of reasons too. Some of them say, "Well, I'll show them that when I'm gone, then they'll miss me."
Yeah.
There's that approach, and others, I can't cope. I just got to kill myself. I mean, there's a variety of approaches to it, but whatever is in the thinking of that young person or older person, you have to unpack. Why do you think that your death is going to be a solution? It'll change from one set of problems in this life to another set of problems in the next. Work out the problems you've got now and don't take a risk with your eternal life. That would be a serious, serious mistake. Sure. And it's worth working through issues. Everybody's got some issues, some are more serious. There's no doubt. And I think the unstable family life that we have now, not only divorce being high, but also the very high rate of unmarried parents. Most typically, one or even both are no longer there with the child. That is a fairly basic experience of rejection.
Yeah.
That is part of it. If they're being abused by somebody, whether peers or sex traffickers, I just saw today that Facebook is the number one, like 60% of child sex trafficking is coming through Facebook. Wow. And are parents monitoring this? The disturbing results of pornography. People are comparing themselves to these actors and other people in porn, a lot of which is fake stuff to begin with, and I can't measure up, and so it's hopeless for me. Rejection by peers, bullying by peers, all kinds. You have to work through it, and that's one of the things. And as far as the issue that you asked me regarding the demonic, that is never my go-to issue. You don't start with demonic influence. The church requires us to always go to the natural explanations. Is there some physical disorder? Is there a psychological issue? Always go to that. That is the vast majority. And demonic influence can be there. I don't exclude it by any means. But you must exhaust the natural explanations before you can go to the supernatural. And I think most of the time the church is really wise in following that through with psychologists and medical doctors. I have another caller. Hello, Stephen?
Hi, Hi, Father.
You're up in Canada. Welcome.
I'm in Canada. I'm in Pakenham.
Great, great. What can we do for you today?
Okay, I transitioned twice. I did 2 8-year periods transitioning to become a woman. I'm 66 now.
Uh-huh.
I never, between the transitions, I became quite religious, and I had a lot of battles with Satan, and I knew. I had always had the inclination in my life. I always knew that this was being stirred up, something otherworldly.
Okay.
And so when I went to do my second transition, I tried to make it pure and clean. I knew everything that Satan was doing to make it a desperation for me
Sure.
to have this operation.
Sure.
But at the same time, there was this internal battle going on. I knew that God did not want me to do it.
Mm-hmm.
I was aware that he didn't want me to do it. And so I managed to stop. I was on the doorstep. I was okayed for surgery. All I had to do was fill out a form, and I would have been in line. And I couldn't do it. And the thing that came out of this was that I battled, and I kept battling, and I finally got stopped. And it was when I knew that God was helping me to stop.
Mm-hmm.
But you know, I half of me wanted to stop, half of me wanted to go, you know. And so finally I got to the point where I could fight it. And I got so determined in my mind to stop that God came in and rescued me.
Mm-hmm.
And the air just cleared.
Yeah.
And Satan was gone. And I realized, oh my goodness, you know, this was all Satan. You know, people think about this is a pandemic. There was, you know, in the 90s when I first transitioned, you know, this was a complete shock to people. You know, this was not going on, and now we've got a pandemic. And a lot of it is created by television. I would say, you know, I mean, the percentage of people that are actually true transsexuals, you know, I think it's, you know, it's almost zero.
Yeah.
The rest are created. Their personalities and characters are manipulated by Satan, and he does it in such it's like he offers these sweet treats to follow this course.
It's, you know, I have to jump in because we're just about out of time. But, you know, I've also counseled folks who started this process, and they said to me, you know, they were counseling with me, and I helped them work through these kind of issues. And they said, I realized in talking through the problems I had that if I had followed this through, I'd be dead. They knew that. Yeah. And they didn't want to die. And they came back. I can't thank you enough because you brought us, you know, a lot of information that we're not getting in the other sources. Thank you for that. And I know that we have a lot of problems. You mentioned freedom of speech and freedom of scientific inquiry is out the window for ideologues. But you've continued on. Thank you for doing that, and thank you for being with my audience.
I'm honored to be here.
It's great to have you. And I want to give all of you a blessing. May Almighty God bless you, give you peace and your true self that God made. May he guide you by his peace and direct you in all your ways. May Almighty God bless you, the Father, the Son, and the Holy Spirit. And we can bring Dr. Van Meter and all the other guests only because the network is brought to you by you. So we ask for your continued support so we can keep bringing these important issues to you. God bless you, and thank you all.